5 days. He was diagnosed with community-acquired pneumonia. This patient's chest x-ray showed bronchiograms in the right lower lobe of his lung, and his pH was slightly acidic, which led us to believe that it was respiratory acidosis and that this patient was not consolidating well.
This patient would benefit from pursed lip breathing because it slows down the expiration, preventing air trapping, and allows for better gas exchange. This also decreases the respiratory rate and panic breathing. This exercise also creates a back pressure during exhalation, which prevents airway collapse. I will first demonstrate on myself, and then I will show the patient doing it. So what I would like you to do is to breathe in with your hand on your stomach, allowing your stomach to expand more than your chest for 2 breaths, or 2 counts, and then out for 4 counts with your lips pursed and your cheeks blown up. I shall demonstrate. Now I would like you to do it. In for 2, and out. 1, 2, 3, 4.
This patient would benefit from a self-performed airway clearance breathing technique. The airway breathing technique we're going to use is the huff cough. This will help move the secretions from the lungs, from the lower lungs to the central airways, decreasing the secretions in the airway. It will help expel as well. So, I'm going to demonstrate this technique, and I'm going to ask my patient to do the technique. To start, we're going to do a huff. So this is low level. It's not going to be really forceful or anything like that. What we're going to do, we're going to breathe in through our nose, hold it for 3 seconds, and then gently kind of force it out. And we hold that force until we feel no more air movement, okay? So it looks something like this. Okay? We'll do that 3 times. And then we'll follow with 3 high-level huffing, which is also known as coughing. So to do that, we'll breathe in through our nose. What we can do to keep that airway open is to put our tongue on the roof of our mouth or have our mouth in a oval formation. So we'll breathe in and use the force from our muscles, okay? So you go ahead. Good. Good. Be sure to have a tissue nearby in case they expel any secretions.
One of the manual secretion techniques that we can use for this patient is percussion. Percussion is used to break up the secretions in the lobes of the lungs for this patient, with this patient having secretion in the lower lung, or the lower lobe of the right lung. We're going to do percussion over the right lung. So we put the patient prone with pillows under his pelvis, and then this allows gravity to assist and help move the secretions upward as we're performing the percussion. So whenever we do this, we're going to have cupped hands, and then we're just going to perform the technique over the right lobe of this patient.
Since this patient has dyspnea, laying down flat will only increase the symptoms. So what we can do to help decrease the symptoms is we're going to have the patient lay down flat. And we can have his head raised upwards to help decrease those symptoms. What we can also do is when he is standing up, and we can have him lean forward, which will help push the abdomen up, raising up the diaphragm, which will help make it easier to push in air and out. So if my lovely patient can stand up for me. So all you're going to do is you're just going to lean forward, and that's going to help you breathe a little bit better.
Much better.
another technique we can use for this patient is called stacked breathing. So for this, the purpose of it is to mobilize secretions and also increase oxygen intake. So for what we can do is we can have this patient seated or standing, and what we are going to have them do is place one hand on the chest and one right on the rib cage. And so what we are going to do is we are going to take one breath and we are going to hold that for a couple seconds. We're going to take another breath on top of that breath, hold it, and then another breath on top of that breath, hold it for 3 to 4 seconds, and then we are going to blow out with a shushing sound. So I will demonstrate that now for you, and then we will have you practice, okay? So we're gonna and this may cause the patient to cough, so we would let them know to cough into their elbow. So now I will have you place one hand on your chest and one right below your rib cage. All right, so I'm going to have you take in a breath. So, yep, hold it, and then yep.
Okay, today we will be doing the manual assisted coughing technique. Our patient has pneumonia and we're just trying to break up the secretions in the lower lobe of the lungs. So I'm gonna put my hands in a W shape. I'm gonna have the patient take a deep breath in, and then when he goes out, I want you to cough. Go ahead and turn your head. And we're gonna do that again. All right, go ahead and take a deep breath in, breath out, and cough.